Welcome to Understanding Your A1c Blood Test. My name is Jill Robart. I'm a registered nurse, certified diabetes educator and care specialist, and a SASH wellness nurse for over 6 years. This video is for educational purposes only and is not intended to replace a conversation between you and your provider. So what is an A1c? An A1c is a blood test, and it shows a 3-month average of your blood glucose. The A1c actually measures the amount of hemoglobin in the blood that has glucose attached to it. Hemoglobin is a protein found inside the red blood cells that carries oxygen throughout the body. Hemoglobin is constantly dying off and regenerating, and the lifespan is 3 months. The A1c test is used to diagnose prediabetes, type 1 and type 2 diabetes, and helps to determine the need for changes in the plan of care or adjustments and medications. This is a slide understanding risk for diabetes. These are A1c numbers. If it's between 4 and 5.6, that's completely normal. Between 5.7 and 6.5 is prediabetes. 6.5 or higher is diabetes, either type 1 or type 2. Obviously, the higher your A1c, the higher your risk for the long-term complications associated with diabetes. So there are several different schools of thought as far as optimal A1c control. The American Diabetes Association would like people to stay under 7.0%. The Endocrinology Association is goaling for 6.5%. However, A1c is an individualized goal determined between the person and their provider, and it is based on other pre-existing conditions, other healthcare issues, age, and quality of life. Your A1c can be converted to understand your estimated average glucose, also known as EAG. So if your A1c is 6.5, which is diagnosing you with diabetes, your average blood sugar would be 140. At 7%, it would be 154. 8%, 183. What we understand from years of trials and studies is that the longer your A1c is over 8%, the likelihood of you having the long-term complications of diabetes is greater. So therefore, optimally, we would like to keep your A1c less than 8%. So why is a high A1c bad for you? We understand the long-term complications of diabetes are scary to think about, but it's important to understand your risk and what you can do to reduce that so that you don't have to be concerned about things like peripheral artery disease, diabetic retinopathy, which is eye disease, increased risk of cataracts, diabetes foot issues, diabetic nephropathy, which is kidney disease, peripheral neuropathy, which is changes to the nerves, mainly in the extremities, also increasing your risk of stroke and heart attack. We've come up with 9 goals for diabetes self-care management. Number 1, control your blood sugar. Reach your predetermined A1c goal. Number 2, if you're overweight, achieve an optimal weight goal for you. Again, this can be discussed with your provider. Number 3, be active. We go for 150 minutes of moderate aerobic activity per week. This turns out to be about 20 to 30 minutes each day. Number 4, eat healthy. Avoid processed foods as much as possible, eating more natural whole grain foods as well as vegetables and fruits. Number 5, if you have diabetes and it has been discussed with your provider, you can monitor your blood sugar to see how you respond to different foods and lifestyle changes. Number 6, and very importantly, please take your medication as it's prescribed. If you're having any side effects or issues, please discuss those with the prescriber. Number 7, be prepared to solve problems. Number 8, develop healthy coping skills. And number 9, if you smoke, please consider quitting. We have lots of resources to help. There are 11 things you can do to reduce your risk of diabetes, heart disease, and stroke. You can quit or reduce tobacco use. Please ask for information on 802 Quits, which provides support as well as nicotine replacement therapy. Move more. Aim for that 150 minutes a week or 20 to 30 minutes a day. Reduce soda and sweetened beverage intake, and this does include most fruit juices. Eat more vegetables, especially the non-starchy vegetables, and those are all the vegetables except for potato, corn, peas, and winter squash. Eat less processed foods, so less foods that come in a box or canned or frozen. Try to create meals around fresh food. Especially foods we want to avoid are cheese, chips, crackers, and cookies, at least reducing intake. Reach and maintain a healthy weight. Get enough sleep. Most people need at least 6 hours or more per night. Get regular dental care. This helps to reduce infection and inflammation, which can increase your blood sugars and ultimately your A1c. Monitor your blood pressure, and please report blood pressures that are over your goal to your provider. Talk to your provider about your risk for diabetes, heart disease, as well as stroke. And possibly attend a class at myhealthyvermont.org. So now that you have these 11 things that you know you can do to reduce your risk, perhaps you'd like to come up with a goal that somewhere you'd like to start. Who can help? Your SASH team. They can provide education. They might have exercise classes and healthy nutrition programs. Definitely speaking to your diabetes care provider. That may be your primary care provider, or perhaps you see an endocrinologist, a doctor that specializes in diabetes. Also, talking to a certified diabetes educator and care specialist who can really help you understand your lifestyle and make healthy changes to reduce your risks. Also, consider enrolling in a diabetes prevention program if you have pre-diabetes, again, A1c of 5.7 to 6.4. If you do have diabetes, consider attending or participating in a diabetes self-management class. And lastly, perhaps you have some support with friends, families, and neighbors. Maybe you can create a walking team and support each other to meet that goal of 150 minutes per week. I'd also make sure to encourage you that if you have any questions about your diabetes control or A1c, please talk to your wellness nurse. She's a wealth of information and can help facilitate communication with your provider.